This patient was referred for sudden distension of the abdomen, in which, as I place the probe in the suprapubic region and try to get the urinary bladder, this is the urinary bladder which is almost empty. This is the urinary bladder, it is empty. Okay, and we go to the longitudinal section to get the uterus as much possible as I can. This is an emergency situation, emergency patient. So in these cases, we can't wait for a lengthy period of time. We have to do a scan as quickly as possible. Now this is the urinary bladder in longitudinal section. This is the uterus. This is the uterus in longitudinal section. And this is the endometrial canal, this one. I'm going to place arrows where the endometrial canal is. This is the endometrial canal. This is the vagina. This is the cervix. This is the anterior segment of the uterus, fundus of the uterus, and this is the posterior wall of the uterus. Measurements. The uterus measures 7.7 centimeters in length and 3.7 centimeters in anterior-posterior diameter. So the dimensions are within normal. The endometrial canal measures only 7.1 millimeter, which is an early proliferative phase of the uterus. And anterior to the uterus, we see a collection in the center of which a cystic area is seen. Now this is the cystic area, and around it you can see a mass-like area, echogenic, mixed echogenicity. This is called the mixed echogenicity. At place it is bright, at places it is darker, again bright. So this is mixed echogenicity mass with cystic area having echogenic borders around it. This one, this area. This is a cystic area. I am not provided with any history, detailed history, gynecological examination. No lab findings are with me. So I have to go by my own experience. Now as I move the probe upwards, I can see that this mass, cystic area, persists within this mixed echo mass. This is the urinary bladder. This is the cystic area, which measures approximately 2.9 centimeter into 3.4 centimeters. And as I move anteriorly, I see the sac-shaped structure with fluid collection, and this fluid collection is seen extending into both thoracic gutters. Now this is the muscle. This is the iliopsoas muscle. This strap you are seeing, this is the muscle, left side, left psoas muscle, and here what you see are septations with internal echoes. These all are septa. This is septa, this is septa, and you can see that this area is filled with echogenous internal echoes. And this finding is very much consistent with bleed. Sonographically, it is